Hello and welcome to this video about evidence-based practice. Every year, the Belgian Red Cross publishes many guidelines and recommendations. In this video, we show you how we come up with these recommendations and what role evidence-based practice plays in this process. For example, suppose a little girl falls and scrapes her knee. There are various ways to treat her scrape, but which treatment is the most effective? There might be an old-fashioned remedy. Or you could of course wait for divine intervention. Or you might find a possible treatment on the internet. But at the Belgian Red Cross, we prefer to base our recommendations on scientific and evidence-based arguments. In other words, we look for scientific studies that compare the various ways of treating scrapes. It turns out that rinsing a scrape with saline solution is just as effective as rinsing it with tap water. Other scientific studies show that histatin, a protein found in saliva, can promote healing. We were unable to find any comparative studies on using disinfectants to treat simple scrapes. Scientific evidence is the first but not the only pillar supporting evidence-based practice. The second pillar is a panel of experts with practical experience who examine the scientific findings. In this case, the experts advise against using saliva because it contains too many bacteria. And disinfectants can delay the healing process, so experts advise against those too. The third pillar is the target audience, who also has a say in evidence-based practice. Little girls think putting saliva on a scraped knee is disgusting. What they really want is a princess plaster. But when it comes to the best way to cover a simple scrape, the science is not really settled. As you can see, evidence-based practice is based on three important pillars.
Hello.
Scientific evidence is the foundation. Expert opinion is the second pillar. And the preference of the target audience is the third pillar. Taken together, all this information and expertise leads to the following recommendation. Use tap water to clean a scrape. A message to all little girls: don't worry, the recommendations made by the Belgian Red Cross are all evidence-based.